Okay, present.
Okay, so I'll start with the chief complaint of this case. Okay, so Hashim, a boy, 8 years, 2 months old, a Rohingyan boy, who was admitted to the pediatric ward HTAA with history of 1 day of fever and vomiting. Now to the HOPI. The patient was apparently well until 1 day prior to admission, where he experienced sudden onset of fever in the morning. According to his father, he noticed that the child was warm to the touch, but there was no documented temperature at home. The fever was continuous throughout the day and was not relieved by tepid sponging. Otherwise, there was no history of sick contact, recent traveling, or outdoor activities. Now, alongside with the fever, the child also had vomiting with 6 to 7 episodes throughout the day. It was non-projectile and contained food particles and watery fluid. The vomitus was about half a cup in volume in each episode. The vomiting was not associated with abdominal pain, diarrhea, and food poisoning. He also claimed that the child refused to take any food since the onset of the illness. He also did not pass any motion that morning, which he usually does. Other than that, the father noticed some changes in the child's behavior as he refused to talk or obey commands. He easily gets irritated. He only lied in bed, looking excessively sleepy, and became less active and cheerful. Otherwise, there was no loss of consciousness, no confusion, no muscle weakness as told by the father. Due to his condition, the father brought him to Clinic Sulaiman Medan Warisan initially, which is just a walking distance from the house. The documented temperature at that time was 38.5 degrees Celsius. He was prescribed with syrup paracetamol, but however, his condition did not improve. Shortly before his presentation to the emergency department of HTAA, the child complained of a headache, which is pulsating in nature, mainly at the frontal region. It was aggravated by exposure to bright light associated with mild neck pain. The father rushed him to the hospital immediately as his child was crying and the condition seemed to worsen. He was unsure about what happened next day at the casualty. Upon further questioning, they have lived in Malaysia for more than 5 years. The father also denied history of cough or ear discharge. That's for history of presenting illness. So, shall I move to the systematic review?
Nuri Shasha ni good lain pula ya?
Sure.
Nuri Shasha. Nuri Shasha group you all juga?
Ya grup D tapi grup nombor lain.
Hanis, any question? Hanis,
Yes, Doctor.
any question?
For the fever, is it associated with chills and rigors?
Fever associated with chills and rigor.
Ada cheese rigor? Faiz,
Tak ada.
mana you tahu?
I
Eh?
tak ada pun.
Macam you tahu tak ada?
Actually, you know what?
Eh?
I pun tak tahu dah. Mungkin boleh, mungkin tak. Mungkin
Umur dia
boleh.
berapa?
Umur dia 8 tahun, 2 bulan.
Boleh tak dia complain cheese and rigors? 8 years.
Boleh.
Other than
Bukan. Boleh. So,
so
I ingat dia macam the father will tell the clerk.
you need the father to tell ke you should ask for it?
From the child. I think, yeah, I'll ask from the child.
Ah. Was it asked or not?
No.
Dato? Is there, is not there?
Yeah, I mean,
Hmm?
I assume tak ada lah, but it was not asked.
Tak ada.
It was,
How you know? Kalau tak ada, surely will mention inside the case note dalam written there. There is no cheese and record.
oh, sekejap.
Kalau
Did
ada,
I miss? Sorry,
kalau ada, you wrote inside there is cheese and record. Kalau tak ada, you wrote inside there is no cheese and record.
it was not written.
So, is there, is not there?
We don't know.
Okay, Masyarah had a question.
Since you say that the child refused to take any food, does he lost any weight?
Pardon? Tak dengar?
Loss of weight.
Loss
of weight.
You ask any loss of weight?
Yes.
Ada tak?
Loss of weight. Tak ada.
No loss of weight.
Dia tak mention.
So, is there, is not there?
We won't know. We won't know if there is loss of weight based on the history.
Any question?
Is there any rashes, skin rashes on the child?
Skin rashes? No, there's no skin rashes.
No skin rashes?
No.
Sure.
Yeah.
Mention there.
It's not in the HOPI lah.
But
in the examination je. But if HOPI then tak ada lah. Tak ada mention of skin rash.
you see, he can have skin rashes a day ago then go off. 24 hour. You're gonna ask the mom about skin rashes ke?
Boleh.
Then what's the difficult about that? It should not. When you examine the child, you only examine the child in that 30 minutes saja. But history can go to 4 to 5 days. So, so is it difficult to ask the mom, is there any rashes or not?
No, it's not.
Then?
Yeah, it's not written.
Taufik?
I want to know if the child has experienced any pain behind the eyes, retroorbital pain.
It was not written.
Nasri?
I want to ask the patient, is there any history of eating outside food?
Eating outside. No.
Hafiz?
Does the patient has any contact with someone who have this same?
Hafiz?
Oh yeah, can you hear me?
Yeah.
Can the have the patient have any contact with someone with the same symptom before?
No history of sick contact.
Ada tak ada?
But the history is written no history of sick contact.
Contact with the sick patient. Aina,
I want to ask if there's any presence of upper respiratory tract infection symptoms such as cough, sore throat, runny nose.
The father denied any history of cough, but runny nose is not written.
Nofahira,
About the vomiting, I want to ask the timing in relation, the timing of the vomiting in relation to feeding. Is it immediately after feed? Is it the vomit immediately after feeding or vomit hours after meal?
It was not mentioned. Yeah, it's not mentioned specifically when.
Alisa,
I want to ask regarding the neck pain. Is there any specific location? Is it on the right or left, or is it associated with any neck swelling?
No, it was. Yeah, there's no neck swelling written, and also on as to whether right or left side pun tak tulis. Could be both.
any other questions? Open.
Did the patient have any joint pain?
Joint pain. It was. Sorry, yeah. Yeah, it was not written either.
Yeah, it's about. It's about his medical.
I want to have ask question
Hello.
regarding the vomiting.
Yeah. Sorry, can you go ahead?
Okay, I want to ask about his past medical history. Does he has any medical problem before or like seizure?
This is his first time in the hospitalization. Before this, there was no documentation. Okay, Nazrul.
Okay, my question regarding the vomiting. Is the vomiting associated with blood or bile, or is it just food particles?
It's just food particles and fluid. Yeah.
How about his immunization history?
Immunization history, there was none. I mean, he's not vaccinated because the parents, they lack the awareness. They are not aware.
So not vaccinated at all?
Not at all.
So other than the neck stiffness, is there any pain anywhere? For example, abdominal pain?
Other than the neck, they mentioned that there is no abdominal pain. But again, there was no mention of muscle or joint pain.
I want to know if there's history of recent infection, ear infection or pneumonia.
Reason of infection, none. It was denied.
Is there any changes in his urination, like the color?
Color, no, it is normal. There is no no pain, no any abnormalities. His urinary habits were normal.
I want to ask, is there any dengue cases around his area or recent fogging activity?
Recent fogging activity, it was not mentioned. Sorry. Yeah.
So, other than him, is there any other family members that have the symptom?
Any other family members? No, there is no other diseases that is apparent on the family members or any history of it.
Hanis, how about the fever is?
For the fever, it's mild, as the temperature recorded during the presentation to the clinic Sulaiman is 38.5, which is mild.
38.5 is mild.
Like upper border, it's nearing to the high grade fever.
It can be able to. If the fever is up and down, you may examine during that time the fever is down.
Yeah. So since the fever is not getting better if after giving the paracetamol, so I guess it's can maybe severe condition, because usually when we give paracetamol, the fever might be a little bit go down.
Is it all fever going to go down?
Not really, but
is that enough to indicate that this fever is not bad? It's mild or severe, but respond to paracetamol only.
no, we cannot say that.
Is there anything else I can tell you the patient fever condition? How bad the fever is?
Then we need to check for the chills and rigors, but it's not mentioned there.
Anything else?
And then if the fever disrupt the patient's daily life, for example, maybe he experienced poor feeding due to the illness.
Anything else?
And then if the fever is associated with lethargy.
Okay. Anything else? Can you describe the type of fever patient is having?
It's continuous.
Continuous.
Yeah.
Not intermittent.
Is continuous.
Yeah, it was continuous.
Continuous.
Persistent or continuous?
Continuous.
Continuous throughout the day.
Continuous throughout the day. Yeah.
Throughout. Berapa hari fever sebelum masuk ward?
1.
So you got persistent fever. Persistent fever, temperature 38.5, not lethargic. Lethargic.
He is less active.
Less active.
Yeah, just less active and less active and cheerful.
Less active but cheerful.
Less active, less cheerful.
Less cheerful lagi.
And he looks excessively sleepy. But
excessively sleepy.
Excessively sleepy. But
you mean when once you talk about excessive sleepy, what you mean?
Yeah, I think he is lethargic, meaning
Lethargy or CNS involvement?
It can
lethargic.
be due to the CNS involvement because it is a sudden
If CNS involvement, apa lagi CNS symptom you want to ask?
weakness of the limb.
Okay, lagi?
Changes in behavior.
Okay, changes behavior lagi?
Photophobia.
Huh?
Photophobia.
Maybe. Anything else?
Blurring of vision. No.
Blurring of vision lagi?
Seizures.
Seizures lagi?
Headache.
The child got headache or not?
Headache, not
Headache in
mentioned.
the frontal region.
Yeah, there is a
You
headache.
mention you dah present dah headache tu.
Sorry.
You
Terlupa.
you lupa, mana boleh lupa history berapa kali baca history tu, orang dengar sekali pun boleh dengar, boleh tu. Boleh ingat.
Sorry. Impulse. Headache, yeah, ada. Frontal region pulsating, aggravated by bright light.
But did the child have other symptom, all the other symptom yang we discussed earlier?
The child has changes in behavior. He refused to talk or obey commands and is easily irritated.
Lagi?
He looks excessively sleepy and is less active.
Seizure ada ke?
Seizure, not mentioned.
Masalah.
Muscle weakness pun not mentioned.
Masalah.
Yes, doctor.
And describe the vomiting.
Vomiting. So
Is it, how severe is that?
I think it's moderate as based on, yes.
Describe dahulu. Describe.
Oh, describe. So vomiting is 3 to 7 episodes throughout the day, and it is non-projectile. And the vomiting contain food particle and watery fluid. There also half of the cup volume for each episode.
Itu je.
Yes, that's all. Yes, that's all about the vomiting based on the HOPI.
Are you satisfied with that?
There was no mention of blood. There's no mention of or bile. They only mention the frequency and the amount and contents of it.
Half a cup.
Half a cup.
That's all. Anything else you want to know about vomiting?
This vomiting is not associated with diarrhea or food poisoning.
No. There's no diarrhea.
Masalah, anything else I want to know you about vomiting? That's all you can tell me about vomiting.
I want to know that there is any trigger that cause the vomiting.
Anything aggravate the vomiting or not?
No mentions of it.
I ask you, I have masalah.
No. No. They does not mention in the HOPI.
Not mentioned, so it's there, it's not there.
Not there. Not there.
So how bad the vomiting is?
That is based on the grade.
Fatin, what do you think?
I think it's a moderate because she vomit about 6 to 7 episode and it's throughout the day. And
Yeah,
also
why just sleepy? Why the child sleepy?
because maybe due to due to the vomit, so
Yeah, so the vomit, then why can't be severe? The child sleepy.
maybe kind to moderate to severe.
They're not such thing moderate to severe. It's mild, moderate, or severe. Je.
So I think severe.
Why is it severe?
Because his father also claimed that the child, since the onset of illness, the child has poor feeding and refused to take any food because maybe it might be due to the disease itself or due to the vomiting.
So what do you think? Due to what?
I think due to the disease because ill patient macam susah nak, macam memang jarang nak makan, memang tak ada nak makan, I think.
So what you think about the vomiting? Mild, moderate, or severe?
I think it's kind of severe.
Severe. But then you say all the sleepiness, everything is due to the disease.
I think it's like combination of both. So like because it's only
You think
one.
vomiting is a disease? You think vomiting is a disease?
No, it's a symptoms.
So
like I think like this condition, this patient is acute, like only one day. So it's started. I'm not sure about that. I think it's due to the disease itself.
What due to the disease? What due to disease? What due to disease?
Maybe meningitis.
What you talking about due to disease?
The symptoms, the fever, the vomit,
The vomiting.
Yeah.
You think due to meningitis? You have to due to the vomiting due to the disease? But I asking you, the vomiting mild, moderate, or severe?
It's a severe.
Severe. 6 to 7 times. Severe how many times? 20, 6, 7, 2 or 3. Moderate how many times? How you know the disease? How you know that the child condition is due to the severe vomiting?
Because maybe this disease lead to the increased intracranial pressure, so they have
But we're talking about vomiting. Now my question is, you think I don't ask about the disease, about the vomiting. You think about the vomiting, mild, moderate, or severe. We know that the vomiting can be due to something underlying. But the vomit itself.
What I found is that for severe, it's like it's a life-threatening consequence, and it's more than 6 episodes in vomiting.
So?
I'm not sure, doctor, about that.
Taufik?
I want to say it's severe because of the frequency of the vomiting. 6 to 7 episodes.
Times you consider severe?
I think so, yeah.
If due to severe vomiting, how the child going condition due to vomiting? What happened if the child is having severe vomiting?
Dehydration.
Is the child dehydrated or not?
The patient is lethargic, which could be a sign of dehydration.
Lethargy only could be sign of dehydration dah. Is it the most important sign of dehydration is lethargy?
No.
Then?
You can also ask the patient the frequency of his urination.
What the frequency urination?
Faiz.
Normal.
What you mean normal?
As claimed by the mom, the urinary frequency macam biasa lah based on observation.
Is it frequency only you want to ask?
Amount.
Amount, color of the urine. Ada ke Faiz? Hello. Hello.
Sorry. My mic was muted. As for the color, sekejap tak mention. Tak mention.
So?
What about
Is that all you want to know about hydration status other than urine?
Can I ask about tear production masa menangis? Banyak
Lagi?
tak keluar air mata?
Ya, 8 years old menangis. Lagi apa lagi?
Not sure.
Not sure. Tear saja.
Dry lips.
Lagi? Itu je lah. So what you think, Licha, hydration status dia?
The hydration status seems normal.
Nazrul lah, what you think, Nazrul?
Firstly, I want to ask the father macam perasan any sunken eyes or cheeks at the patient.
So any or not? Any sunken eyes and cheek?
Dia tak mention.
I think for the hydration status for this patient, due to the vomiting, I think it dehydrated.
Dehydrated, urine output is normal. Urine frequency is normal.
Maybe during the day, the urine output is normal. Maybe before the emission.
How do you know animation history or
urine
not?
output
During emission?
I think Faiz mentioned that he mentioned I think Faiz mentioned that the father noticed that the child did not pass any motion on the morning, which the patient
So
usually does.
apa kaitan motion dengan dehydration?
So that the output is reduced.
I mean that if you have dehydration, you shouldn't pass motion. Huh?
What that?
If you are dehydrated, you shouldn't pass motion. Hmm? One sign and symptom of dehydration is they do not pass motion.
No.
Alright. Ya ke?
No, I think.
Then why you mention pass motion pula? What's the reason you mention pass motion?
Maybe maybe the father because usually child will urinate during when they pass motion, right? I think. So
when you 8 years old, you urinate to urinate. You wait until you pass. You wait until you want to pass motion, only you urinate. Jadi you just urinate once a day sajalah. You urinate once a day only. Hafiz.
Okay, so for the vomiting, since our patient has only signs of lethargy, and for the sunken eyes or a cheek, is there anything from the physical examination saying anything about sunken eye?
You already apa tu? You already I already let you all to ask already. Now from the history, you listen. What do you think about the vomiting? How significant is vomiting is?
Oh, so since the patient has only lethargy, so I think it's a mild dehydration due to vomiting.
Mild hydration. What's the evidence the child got mild hydration?
The the child has only lethargy, but there is no.
You know, lethargy in dehydration is severe. Tahu tak? Baca baik tu. If the child got mild dehydration, the child don't have lethargy at all.
Moderate. So it's a
severe.
Yeah.
Severe
the
dehydration.
severe dehydration, but the patient has only sign of lethargy. No.
If the patient has severe dehydration, why is patient urine frequency normal?
So it's a moderate dehydration.
Yeah?
It's a moderate dehydration.
Moderate dehydration.
Yeah.
Why you say patient moderate dehydration?
Due to
No,
normal.
you kalau you buka dehydration, kalau moderate, there will be decrease already urine output.
Because the history said normal frequency, but doesn't mention any of the volume. So
Okay, tapi the first thing you might have dehydration, the volume will decrease, the color can be yellow. No, you faham tak? But have moderate dehydration, the frequency will be decreased. You tak tahu, you tak baca semua ni. Masalahnya you all ni. Become dry, mucosa become dry. Skin become dry, mucosa become dry. The patient have all those things.
if the patient have all those things, so it's a sign of.
You buka the hydration status. Ada buku hydration status, baca, buka.
What
Buka
book?
Hafiz.
What book? Which book? I'm sorry, but which book, doctor?
Hydration status dan predict protocol dia dah, hydration status. Dalam internet pun, you buka internet pun can tell you hydration status dah. Assessment for hydration status.
Okay, I'll check first.
Check lah sekarang. Dah check dah. Siapa boleh buka check book hydration status? Assessment to hydration status. Buka. Ada?
Yes, betul. Ada. Ada dah buka.
Baca. Mal apa kalau mal?
Mal, the general appearance, the patient appear well, consciousness level alert and responsive, the urine output is normal, skin color is normal, extremities warm, eye is normal, mucous membrane moist, heart rate normal, breathing normal, peripheral pulse normal, capillary refill time normal, skin turgor normal, blood pressure normal.
Moderate.
Moderate, general appearance, the patient may appear unwell or deteriorating. The conscious level after the responsiveness. For example, patient may irritable or lethargic, urine output decrease, skin color normal, extremities warm, eyes sunken, mucous membrane dry, heart rate tachycardia, breathing tachypnea, peripheral pulse normal, capillary refill time normal, skin turgor reduced, blood pressure normal.
Urine output?
Urine output decrease.
Decrease. Kalau more tu severe?
Appearance for the severe, patient appear unwell, conscious level, decrease level of the consciousness, urine output decrease,
Lagi? Tak dengar?
Skin color, eyes grossly sunken.
You dengar tak cakap dah?
Internet connection could
Repeat semula tadi. Severe. Severe. Repeat semula.
Yes. Appearance unwell. Conscious level decrease. Urine output decrease. Skin color pale. Extremities cold. Eyes grossly sunken. Mucous membrane dry. Heart rate tachycardia. Breathing tachypnea. Pulse weak. Capillary refill time prolonged than 2 seconds. Skin turgor reduced. Blood pressure, hypotension.
So, Hafiz,
We need to know the general appearance of the patient first.
you dah dengar history dah.
So,
Aina, what do you think?
I think it is moderate.
Moderate. You dah put the normal.
I think we need to do further physical examination to determine, because the patient might be lethargic due to the disease and not due to the dehydration.
Kenapa Hafiz tak boleh fikir macam tu? Hafiz? Your colleague will think like that, you cannot think like that. Why? Very poor insight. No Hafira, what the essence of the case?
Eight years boy with suspected meningitis.
Aliza?
8 years old boy with suspected meningitis.
Stupidnya. What ulang yang sama?
Sorry, doctor, my internet connection was not good.
No Hanis.
8 years old boy with fever and vomiting for 1 day.
Tu je. Unless you go back the chief complaint. What's the chief complaint in this case?
Fever and vomiting.
Is that the main reason why the patient come to the hospital? Or the mother, father are worried about the sleepiness, decrease in change in conscious level? Which one? Usually, fever and vomiting 1 day, people come to hospital or not?
Usually not.
Is it usual to bring the child? Usually, mana dia orang bawa kalau fever for 1 day?
Klinik.
Or vomiting 1 day?
Klinik kesihatan.
Alisa, mana bawa?
Pharmacy.
Farmasi je. Awak malukan doktor je. Ha? Gimana? Jumpa you dulu lah. Awak juga farmasis.
Oh, okay.
Ha.
Klinik biasa.
Ha. Kesihatan ke GP ke. So what do you think about the chief complaint? Are you sure his chief complaint is that? Or something else?
From the HOPI, the father mentioned that when he noticed that his child has headache, which is pulsating in nature, and it is aggravated by exposure to bright light and mild neck pain, he rushed to the hospital.
So what you think the causes, the possible chief complaint in this case?
Headache and neck pain.
Neck pain, okay. But headache is one. Lagi? Don't you think parents are concerned about his child sleepy, continuously sleepy? Can it be a chief complaint or not?
It can be if the presentation is like a sudden, like
Yes, but for you looking for the history, you think what is the thing that concerns the parent the most? Headache is another one. Satu lagi?
Behavior changes.
Behavior changes maybe because the father seem to be recognize the child become very sleepy like, is it? Which one concern you more? Is your father or mother? The child got fever for one day, or your child is look sleepy? Yeah.
Sleepy and less active.
Which one concern you more? So in this case, if you look back to this case in this case, what is the essence of the possible essence of this case? If you looking back, sit down with probably chief complaint are different. What the essence of this case? Leah.
Persistent vomiting.
Astaghfirullahaladzim. You see kita dah discuss punya lama tak dapat lagi. Orang lain dah dapat, you tak dapat lagi. If you look back, if you go for the history awal, this child is a 8 years old child, boy or girl, boy, with fever and vomiting for one day. But do we agree probably there is not the real chief complaint? Because it seems that is not the one that made the parent rush to the hospital. So
headache.
The parent so the parent are more concerned about headache
and photophobia.
Photophobia doesn't matter. Headache, photophobia, or patient are more concerned about patient become more sleepy. So what the essence of this case?
Eight years, excessively sleepy, photophobia, and neck pain.
Don't you think or not? If you look at the first essence and second essence, if you take that one, don't you think that the way you're going to look at the case will be different compared to first essence and second essence?
Yes.
Huh?
Yes.
Different or not?
Different.
So that's why what are the most important things about any case before you want to go forward in any case? what is important, most important thing you must be able to identify?
The thing that worries the
What the thing, what we call that?
chief complaint.
Yes, the chief complaint. If you wrongly identify the chief complaint, the way you're thinking about the case will be totally wrong. If you, that's why you have to really identify the chief complaint. What is the chief complaint of the case? Because it's really give you the process how to think about the case. You see, cough and vomiting and fever. Can you tell me what is the possible, what the next thing come to your mind? This is the child with cough vomiting. What this thing come to your mind?
Poisoning.
What the thing? This is the child with having fever with vomiting. What the thing you come to your mind?
Gastroenteritis.
So that is what we call that. All the causes of
GI.
cough, fever and
Vomiting.
vomiting. It can be mainly the GIT system, or it can be the other system, but mainly thinking the GIT system. So what the thing come to mind, the causes of vomiting and fever. So you're talking about this, the case, 8 years old boy who have headache and sleep and not headache for 1 day and excessive sleepiness for 1 day. But the next thing come to your mind.
Maybe due to the neurological.
Yes. The causes, you're thinking about the causes, which is mainly possible of neurological condition. So which one can quickly can get you to solve the patient problem?
The second
You
essence.
still, even fever, vomiting, you can still think it's neurological condition, but it will not be the first in the line, is it? If the child got headache and this is sleepiness, the first in the line will be your neurological condition. Then second will be your other conditions. You can read the causes of vomiting and fever inside where you can get the causes in the book, is it? And then you baca buku tu, you tengok what is possible compared to the case. Banyak benda tak tally kan. Hitung AGE, how the child is lethargy 1 day only, how the child got sleepiness, how the child got sensorial, how the child got headache. You cannot explain. Whereas you go to second case, you thinking about CNS, possible CNS, the headache. So the concern is about the headache. So what the possible cause of headache? Anybody? Tak tahu.
Meningitis.
Lagi?
Okay.
Lagi?
Trauma.
Lagi?
Migraine.
Lagi?
CNS tumor.
Ha?
CNS tumor.
Tak dengar.
CNS tumor.
Ya, okay. Lagi? So where you can get
Encephalitis.
Pardon?
Encephalitis.
Encephalitis, okay. Where you can get all the causes? Where you can get all the causes?
From the book.
Yeah, from the book. from the book, is it? So you read your book and you compare with the patient finding. Is it possible this patient having space occupying lesion?
Less likely
Hmm?
because there is no documented weakness of the limbs.
Not documented, we don't know. Because it was not mentioned. Weakness lagi, apa lagi? Weakness lagi?
Weakness, sleepy, refuse to eat.
So what I mean is that, is it possible to check having SOS, space occupying lesion?
No. Is
it possible to have likely to have space occupying lesion in symptom in one day? Headache in one day?
Oh, less likely no.
Lagi? You tak baca tu jadi macam tu. Katalah you baca, you study, you buka this case. Oh, this is the case possible of space occupying lesion. Itu something in the brain. One of possibility is space occupying lesion. You baca dalam space occupying lesion. 8 years old, the many possibility of ni, and then usually they going to have a persistent headache with which is can resolve by vomiting, and they can have a change in sensorium, or they can have a decrease in vision, weakness in any part of the body, they can have seizure. Semua dalam buku. Compare to your patient. It can meningitis. Meningitis, they can have fever, and then they can headache, photophobia, neck stiffness, vomiting, change in sensorium, seizure. The symptom they can come in one day. Encephalitis, headache, but non-neck stiffness, not much photophobia, but they can have change in sensorium. Semua dalam buku je. What you do is that you compare the symptoms with your patient. You see, if you do that, you already read a lot about the case. Satu case tu pun can give you a lot of a perspective. Finish already all your reading. Is it a blood in blood in the brain? So bleeding in the brain. Is it what? All the answer by the history can help you a lot. If talking about the case with vomiting and fever, then is there any eating outside? Is there any diarrhea? Is there eating something that suddenly vomit after that? Even fever, vomiting ni very non-specific. Dengue pun boleh. Faham tak? Pharyngitis pun boleh. If pharyngitis, child complete sore throat or not? You study that this case, Faiz? Hello? Salah? Yeah. BR? Tak apalah, I ada check balik. Rupanya my pesan-pesan tu tak hantar lagi. Dia pun satu hal juga. I call dia 2-3 hari, I call tak dapat. Tapi bila go to, tapi BR sepatutnya hantar 15 kan? Tak tahu dia. Tak apalah, I ada redo balik dengan dia. Nanti dia hantar. Sorry lah about that. Because dia tak hantar, dia tak beritahu kita orang dia tak hantar lagi. I pun sepatutnya 15. Dia ada kenapa tak hantar lagi? Sepatutnya 15, sepatutnya arahan 15 dia kena hantar. Dan dia tak beritahu yang dia tak hantar, dia tahu tak? Dia tak beritahu dia tak hantar. Itulah. Jadi kita pun alah boleh tetih lah. Sebab dia tak beritahu kepada kita dia tak hantar. Kalau dia beritahu kata tak hantar lagi di semua, jadi I tahu apa benda dia. Tak tahu. So sebab dia beritahu by 15 you also nak. No, lepas tu dia senyap tak nak apa. Tadi by today kena sort out, kena hantar juga hari ni, beritahu dia. Ataupun this one tak apalah, ada go through dah. Ada modify itu bit dah. Anyway, thanks for asking. I sorry lah pagi tadi, so I tak tahu dia tak hantar lagi. Beritahu pada Encik Anwar, I sorry about dia. Okay, thanks lah. Okay.
I read a bit lah. I read mostly on the diseases that cause headache and fever.
Headache and?
Headache and fever.
Headache and fever.
Headache and fever, which is
how you focus headache and fever? Well, the chief complaint you present to me is not headache and fever. The chief complaint you present to me fever and vomiting.
Fever. Oh yeah, sorry.
You see, you pun didn't internalize the patient, the patient history. You know, very disappointed. When you get this history to present?
From the past years.
When we get the history to present?
When you get the history to present?
When you get it? Yesterday, 4 days ago, 5 days ago?
Oh, but like 4 days, 3 days ago.
You still cannot internalize the history. Right, you don't need to, you do understand, you memorize the history. You don't need to go check when people asking you. You can already answer yes, that, don't, yes, that. Then we know that you already internalize the history. You have to go check again, and kadang what you check, you cakap pun salah. So you mean that you not internalize the history. Tak impressive at all. It's okay, you mean we can discuss. But you see, is the presenter also not clear about history? Don't you think I myself got boring? Because I say, what is this? The presenter pun history pun tak clear. Doesn't know this history. Padahal history pun panjang sangat. Present ni 15 minit, probably dalam less than 150 words saja. Boleh hafal lah. Still unable to internalize. You mean that you didn't analyze the history yourself? You baca je, you baca tu. Orang analyze the history satu-satu, internalize. Then you imagine the patient dalam history tu macam mana. You see, you read the history, you imagine your patient according to the history tu. How bad the patient is. What is the problem the patient is. Bila you study the history tu?
2 days ago.
2 days ago. Nampak you. It's enough already 2 days ago to go by the history. Because you tak panjang. It's acute case. It's not the case with child with the Fortic syndrome ke thalassemia ke where the history can be long. This one acute case. Acute case the history is short. Tak panjang. Tapi yang penting dalam history ialah positive and negative history. The history is not there. When you go analyze the history, you yourself found out satu benda tak kena dalam history tu. Something is not kena dalam history tu. Because you also know, if you imagine yourself, how come you one day vomiting and fever, one day you already went to the A&E? How many people going to do that? Most of the time, they will go to the GP first or UKK first because vomiting and just vomiting and fever. It's not an emergency condition. It's still something else reason why they went to hospital A&E. Don't you think just need a common sense only? Unless you're talking about the chest vomit sampai dia dehydrated, makan pun vomit sampai keluar berdarah. Vomit cause electrolyte imbalance, lethargy because of that. Then you can talk about that's case picture with diabetes, ketoacidosis. They vomit for 1 day and then admit because why is you vomiting? You can say, then you can think, probably the vomiting is a very severe, that child need to go to emergency department. That's why you see, when you come to my teaching, I'm going to ask each one of you, what do you think about the chief complaint, symptoms, how severe is that? What you think about the fever, what you think about vomiting? You think severe or not severe? Because that is the chief complaint. Chief complaint just not adequate to know the chief complaint. You must know how bad the chief complaint is, because that will tell you how you want to manage your patient. How the intensity of to manage your patient depend on the chief complaint. Any other questions? Any other questions? Other questions? Alisa, any questions? Tak ada. What do you think about the case?
Doktor, let's just say dalam clinical situation, macam kalau kita dah find out ada, you know, like something like neck stiffness and headache, yang lain tu boleh rule out.
You see, neck stiffness, you don't find in history. Neck stiffness is by the
examination.
Unless you're talking to parents, so very good. You hire parents some more. How you think they will know neck stiffness? Stiffness mainly is by physical examination. Have we gone to physical examination?
No.
No. Why we cannot go to physical examination?
I don't know. We want to focus on history.
Because your history tak pass lagi. You understand? We cannot go beyond than history yet. How you want to go physical examination when the history is still so many things about the history not clear? You see, I'm very impressed if you tell me, Doctor, I have read this case note, but I'm not happy with the history. It's not complete because there is things that is not in the history that I would like to know. Wow, I would say Faiz very good. He read the history, this oral history, but he analyzed it. He said he's not happy with the history because for him the history satu, the history dengan clinical symptom tak tally. Satu, there are many things in the history not complete. You cannot make the differential diagnosis because the history is incomplete. I will Faiz very good. Then now we not need to discuss history so much. Let's go for physical finding to see what yours see. You faham? I expected something like that. Impressed. Comment about the history. You give your opinion about history because it's somebody else's history. See, if I the one who clerk, I will find this thing which is not mentioned inside the history. I would like to go more further. Then I will say, wow, it's very good. He knows what he want to look at. I'm waiting for that. Tak dapat. Macam mana? Because I know you already study the case and there's the thing that you're not happy about the history. Don't you think if you do that, I will be very impressed? Just I tak impressed.
Impressed.
Yeah, so who Faiz Beritahu my colleague tak payahlah Faiz ambil exam BBS. Pass dia teruslah doktor. Tak yang BBS, he really very good about history. Dia dah tahu dah history tak bagus lah.
Tapi doktor, kalau history dia complete kan to the brim, then macam what is today's discussion gonna be
Is
about?
there any perfect history or not?
No, tak ada lah.
Tak ada.
Tak ada.
Perfection is only God only. Tak ada complete history. Don't worry. Tapi if we can tell you the history is adequate or inadequate. There's no such thing. Don't go for perfection. You all go to perfection ke? Hidup you je. Dalam medical ni, you go to perfection. Matilah you all go to perfection. Memang you all akan die lah. Memang stress. You go to perfection, you stress lah. Memang very stressful. Because tak akan capai. What we want you to do is to go for adequate. Cukup lah, cukup makan. Cukup ni cukup makan, cukup ni, cukup tak kira lah. Cukup banyak, cukup ni, asal cukup je. Adequate, history is adequate. We say kalau history perfect, wah dahsyat lah you. I pun doktor pakar, consultant tak dapat perfect history. Ada lagi I miss. Go for adequacy. Adequate, history is adequate. And then adequate for your level. We expected what is your level is. I don't expect that your history will be same like a specialist history. Sure, different. But at least it must be at some level. And then some level, then you are allowed to criticize. Dia tu doktor pakar history, specialist history tak complete juga. Doktor, I rasa history, the specialist history ni tak complete lah. Ada benda lagi, tak cukup lagi. Tak adequate lagi. Lagi I impress.
Tak disrespectful ke macam tu? Tak rasa macam dia tak disrespectful kalau buat macam tu. Macam you criticize.
You see, masa teaching ni, you tak boleh lah so sentimental. Perhaps you can say, in order to be more adequate, the history should have this. Bukan you kata diplomatically, you don't say this history is not complete. I think if I add this one, this history will become better. There's nothing wrong with that. You use your word lah, your words to. Okay, any questions? Respect, disrespect. I dah teach banyak daripada Mak Saleh, Cina, India, Melayu. I dah go through. Cina pun ada mengajar, India, Mak Saleh pernah mengajar kat overseas dulu. So I know how they are, how you are semua. Each different. Sometimes they bring out. Mak Saleh they're very critical. Dia tak ada kata disrespect, not respectful. For them, they think that is they are more
open-minded.
You all open-minded juga. You all more cakap. If they like, they say. If they don't like, they say. Apa kita panggil? More forthcoming, more
direct, blunt.
Blunt, more blunt. Pandai pun you. Tak ada words tu, you dapat words tu. More blunt. And you live in their culture, that's how you're going to be. You have to adapt to their culture lah. Dia orang bagi dia orang okay je. Because that is their culture. Ada apa? Okay, dah pukul 5 dah. Ada apa lagi tak? You all dah. Razwi ada apa? Tak ada? Taufik? Alisa nampak cuma mata je. Noafira, Fatin, Hanis, nak tengok Hanis muka penuh full, confident dia. Full muka dia. Dapat buka bahu tu nampak. You all ada nampak mata, ada nampak cuma mata je. Dia nampak tu je. Bagus, dia takut I kenal nampak muka you all. You tahu kalau you datang sekarang tak lawak, tak kenal you all, semua letak mask, tak siapa-siapa dah tahu. Macam Faiz, I always ingat rambut dia tu. Okay, that's all finish for today. Okay.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Dato.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Tanya.